Good afternoon, everyone, and thank you so much for joining us today. We can see some familiar faces and new folks joining us today. Thank you so much for taking our time. My name is Monica Rana. I go with pronouns she, her, hers, and I welcome you all on behalf of Stigma and Resilience Among Vulnerable Youth Center, as we call it SARAVYC, which is based in the School of Nursing at University of British Columbia, Vancouver campus. And I am the managing director of SARAVYC. Before we begin, I would like to start by acknowledging that Saewyc is located on the traditional, ancestral, and unceded territory of the Musqueam people. We also acknowledge and honor the traditional territories and homelands of the Indigenous peoples across the many regions where our work and collaborations take place. We at Saewyc are committed to learning from and working in respectful partnerships with Indigenous communities. At our center here at SARAVYC, we focus on research that supports the health and well-being of marginalized youth, particularly those who experience stigma and discrimination. And today marks the first webinar in our new SARAVYC webinar series, which will take place on the third Thursday of every month. We are excited to launch this series as a space to share knowledge, research, and practices that promotes equity and resilience among youth. With that, I would like to, it's my pleasure to introduce Dr. Elizabeth Saewyc, who is our speaker for today, who's also Executive Director of SARAVYC and Professor and Director at School of Nursing here at UBC. Dr. Saewyc is a leading public health researcher. Many of us know her, whose work has influenced youth policies and practices both in Canada and internationally. Dr. Saewyc, welcome and thank you.
Thank you, Monica. So I'm just going to share my screen, make sure that everyone can see. As Monica said, this is our first of a new renewal of our series of SARAVYC at Lunch, and we'll be doing this the third Thursdays. And we're specifically doing this one in around the timing of the International Day Against Homophobia, Biphobia, and Transphobia, which was last Saturday, or IDAHOBIT, as we like to say. And so today we wanted to bring research about the SOGI 123 program, and I'll be talking about our evaluation. So first, just a quick, for those who might not know what SOGI 123 is, this is actually a program of school and teacher resources to create inclusive classrooms and to support inclusive schools for primarily for 2S LGBTQ+ youth, but generally for creating safe spaces for all. And this is a program that has been developed with Ministry of Education funding and other funding by ARC Foundation, and I see ARC Foundation is here today. Shout out and hi. We partnered with them to actually provide an evaluation of this work. So part of what SOGI 123 involves is school champions and district leads who are expert teachers who bring together support, including course materials and action strategies and policy templates from SOGI 123. All of the resources and materials are available on their website, but the school champions and district leads actually help support the administration and the teachers and students in schools to actually create change to support more inclusive environments, inclusive curriculum, and healthy policies to reduce bullying and increase support. Now, this was originally launched actually in 2015-16 with one school district, Delta, and then subsequently piloted in 2016-17 school year with 9 school districts in BC. And then over the next 2 years, there were like 36 school districts that then signed up the next year and then the next year. So that by the fall of 2018-19 school year, all the districts had participated and were signed up. Now, how much they actually learned from and implemented and took on action is quite variable across the province. and variable across the different schools within each school district, but they have materials and supports for everyone from K to 12. So there are resources that people draw on. So our research question in partnering, so we were partnering with ARC Foundation with some funding from the Canadian Institutes of Health Research and with student fellowship support from the Quartermain SOGI Fund to actually answer two questions specifically around, first, are there impacts from SOGI 1, 2, 3 that we can measure? And then second, what are lessons learned for actually implementing it well? And what are resources that are needed to actually be effective about it. Today, I'm talking about the first question, is looking at what is the impact for students. And so the three questions that we really focused on in the looking at the impact for students was, does SOGI 1, 2, 3 reduce the prevalence of bullying and sexual orientation-based discrimination in schools that have implemented it sooner rather than later, so the earlier adopters, if you will? And because we know that GSAs have significant contributions in terms of creating safer spaces in schools and encouraging healthy well-being for students and reducing bullying and discrimination itself, we're kind of, but what about when there are GSAs as well in schools, or maybe they aren't, or maybe SOGI 1, 2, 3 is helping to implement GSAs in a school? So how do we disentangle, if we can, the impact of GSAs separately from SOGI 1, 2, 3? And because we've seen with GSAs that this can have impact beyond LGBTQ populations, can we see not just for LGBTQ students, but also for heterosexual and cisgender students? Are there any impacts? So these were the questions that guided our particular approach. So what I'm going to talk about today was the analyses we did at the population level across the province. We looked at 10 years of data from the BC Adolescent Health Survey. So in 2013, before there was any SOGI 1, 2, 3, in 2018, when the early adopters were in place, but the other school districts hadn't really taken it up yet. And then in 2023, when all school districts have been involved, and a number of them have been involved for a lot of years. So the measures that we used were looking at how long since SOGI got started, so the early and later adopters of SOGI 1, 2, 3. How many years have you had a GSA in place, including, if you haven't had one, 0. And then we looked at both teasing at school, so that's verbal harassment, social exclusion at school, physical assault at school, and discrimination due to sexual orientation, or because people think you are gay, lesbian, or bisexual. As you might expect, there are actually a lot of heterosexual kids who get teased with being accused of being gay, lesbian, or bi. And what we have found in our other research is, doesn't matter if you are or aren't being harassed or bullied due to a perceived sexual orientation also has negative effects. So to give you a sense of the sample, what we were doing, nearly 100,000 students in grades 7 to 12 across the province in 482 public schools. So we needed to make sure that there were schools that participated in 2013, 2018, and 2023. And 55 out of 60 of the school districts were part of the sample. So you can see here that that ended up being nearly 30,000, then 35,000 students each year. And as you can tell, the number of students who identify as lesbian, gay, bisexual, pansexual actually increased, nearly doubled by the time we get 10 years later in 2023. This translates to an estimated 13,400 LGBT plus students. Now, I do want to note that in our analysis, we weren't able to include gender diverse students as a separate group in terms of the LGBTQ plus, because we only started asking about trans and non-binary identities in 2018 and 2023. So we aren't able to report them separately. However, I can tell you that in 2018 and 2023, gender diverse youth were way more likely to identify as gay, lesbian, bisexual, pansexual, and asexual than their cisgender peers. So they're in the data. They're just not separately identified as trans and non-binary. Now for analyses, we used our award-winning and extremely geeky site-level longitudinal effects of population health interventions approach, or SLEPI as we call it. This is, for the technical stats folks in the room, a nested multi-group, multi-level modeling using M+ of repeated cross-sectional data within schools across the survey years. And this approach allows us to model effects between and within groups, accounting for cluster effects of the fact that we're sampling in classrooms in schools, and that has that particular influence. Now, a way to think about this is, rather, although we have individual young people who are identifying whether they've been harassed or discriminated against or physically assaulted, we are actually looking at the school as the site, as the unit of analysis. And we're looking at, within a school across time, the students who are answering. And this allows us to control for the fact that we have different kids in school in each of those years. And as you can see, for example, school 1, maybe they had a GSA, but in 2013, nobody had SOGI 1, 2, 3, but maybe other schools didn't. And then along the way in 2018, school 1 might have had a GSA and SOGI 1, 2, 3, but school 2 only had SOGI 1, 2, 3, no GSA. And school 3 might not have been among the early adopters, and so didn't have either still. So still our control or comparison group. And by the time we get to 2023, places that might have had a GSA still have a GSA. New place might have gotten a GSA, but some schools may still have no GSA, but now they have SOGI 1, 2, 3. So this is an opportunity for us, using this very complex modeling, to actually compare where people are a control group and then they become part of the intervention. And this allows us to actually look at schools if and when they start the intervention, so that control group can shift to the intervention group along the way. But this approach allows us to control for some of the key reasons why you would do a randomized controlled trial, which you can't do with large school districts. And that is, it allows us to actually make causal inference, because it controls for cohort effects, it controls for change over time, things that might be going on in the larger environments, and it controls for the differences between sampling across the schools, just in case, for example, there are more LGBT youth in 2023 than there were in 2013. So this is a particularly useful approach when you can't do randomized trials and you're looking at populations. So in the population overall in all the schools between 2013 and 2023, we actually don't see a huge amount of change for LGBT girls, but we do see a decline in teasing at school, or that verbal harassment, for LGBT boys. When we use SLEPI, what we find is, when you've controlling, now we're including both SOGI 1, 2, 3 and GSAs in the model so that we can actually control for each other and see their separate influence. And what we see is that SOGI 1, 2, 3 actually has an impact for LGBT plus Q boys, but not for girls and not for heterosexual students when it comes for teasing at school. GSAs, on the other hand, have a significant decrease in that verbal harassment for all sexual orientation groups over time. And so this is one of the things that we're seeing when it comes to teasing. When it comes to being excluded on purpose, overall in the sample, what we see is that it's pretty much unchanged again for sexual minority girls, and it has declined a bit for sexual minority boys. When we look within the schools around SOGI 1, 2, 3 and GSAs, we see that SOGI 1, 2, 3 actually, in the schools that were early adopters, their social exclusion declined for LGBTQ plus boys and for heterosexual girls, and GSA significantly decreased exclusion for all groups. For being assaulted at school, this is something that we saw declines for boys, slight uptick and then decline for girls. And what we see in the data for heterosexual kids especially is that SOGI 1, 2, 3 actually was associated with reduced physical assaults for heterosexual boys and for girls. And in fact, when you control for GSAs, the effect size for SOGI 1, 2, 3 was actually greater than for the effect sizes with GSAs. And GSAs reduced physical assaults for LGBTQ plus girls as well. Now, when it comes to discrimination due to perceived sexual orientation, this is one of the things we saw as a concerning trend over time in the province as a whole. We saw that the prevalence of discrimination actually increased for girls, both sexual minority girls and heterosexual girls, over the course of that 10-year. It remained sort of unchanged for sexual minority boys. However, in schools that were early adopters for SOGI 123 and those who had GSAs, we saw that both SOGI 123 and GSAs independently decreased discrimination around sexual orientation for both LGBTQ plus students and for heterosexual boys, not for heterosexual girls. And again, we see larger effect sizes. And in fact, what we are seeing with this particular variable is that the kind of effect sizes that we're seeing in the SLEFI modeling is actually larger, like quite a bit larger than we've seen when we've used SLEFI analyses looking at GSAs and school policies and other things, where generally we're seeing effect sizes that are at like the 0.3, 0.4 kind of. These are more at like 1.2 and 0.89, so much larger. And what this means in terms of interpreting it is the longer SOGI 123 has been in place in the school district in that school, and the longer they've had GSAs, the decline in discrimination continues to decline. So our conclusion, SOGI 123 and GSAs each independently contribute to reducing bullying and discrimination at school. And though LGBTQ plus discrimination increased over time across the entire province, where schools had SOGI 123 early on and or had GSAs, it actually went down. This suggests that, in fact, in schools that didn't have SOGI 123 and didn't have GSAs, it actually got a lot worse because the overall was that it increased. We also see that the longer SOGI 123 or a GSA has been in a school, the larger the improvement over time. And that improvement is steady across years. We're not seeing like a peak and then it begins to decline. It has, with the modeling, we're identifying that it's actually a steady increase. So we still yet haven't observed kind of that peak time period in terms of it just continues to improve, which is really quite promising. SOGI 123 training and support from school staff, which is really an indirect kind of intervention for students, does appear to be effective in terms of strategies for creating a less violent environment for all youth. So this actually is in some ways a generic anti-bullying program because it does reduce bullying for heterosexual as well as queer youth. Now, this is just a quick view of the key highlights, but our report, which has much more detail, including all the effect size numbers for those who might like to see that, and the interview qualitative data we did around how you implement SOGI 123 and what are the things that are needed in terms of the kinds of supports to do well as what teachers and district leads feel are some of the impacts of SOGI 123 that we weren't able to capture in school-based survey data. So you can actually see that at our SARAVYC website. And of course, as ever, I do need to acknowledge that we are funded by the Canadian Institutes of Health Research and a student fellowship from the Quartermain SOGI Fund with matching funds from the UBC Blue and Gold campaign. So I will stop sharing now and leave the opportunity open for questions.
You so much, Elizabeth. And yes, we have 10 minutes for Q&As.
Geraldine, good to see you.
Hi, Elizabeth. As somebody who doesn't know the school curriculum thing very well, what actually, how complicated, I guess I would say, are the are the SOGI curriculum related things? How much investment does the school need to put into it and things like that?
Right, very good questions. So the really nice thing about the SOGI materials and resources is in some ways it's a choose your own adventure. Schools can adopt as much or as little of the materials. And in some places, they're actually motivated to create additional resources and then share them with the SOGI network. So there are things as simple as, here are some posters and stickers that you can put up around your school. There are materials about how you implement elements of inclusivity in thinking about teaching math, or content and lesson plans for your 10th grade career planning program, or other kinds of approaches to support teachers. But then there's also training materials for how to help teachers intervene around bias-based bullying, or how to support a student who is reaching out and asking questions about sexual orientation or gender, or there are recommendations for books at which grade levels, the variety of things. There are also resources like policy templates for a school district or a school itself to adopt inclusive policies, or protocols for how they will respond to bullying in their school, appropriate for grade level. So it's a lot of resources. Schools, the funding by the ministry does provide support for these resource teachers and champions. So obviously that's a cost if that wasn't available, and that's providing that support because teachers are busy, and having that opportunity to have someone else to help. And as Reg put in the chat, SOGI 123 itself is not a curriculum per se. It isn't you have to do these things. It's actually a bunch of resources that teachers then and the school itself or the school district can look at and recommend and integrate so that it actually meets the curriculum guidance that are required by the ministry.
I just saw Adolescence, the Netflix film, and it struck me that this was a heterosexual boy, and yet the gender and violence related issues in that were huge. By the way, I'd recommend it.
It is one of those things that was for us a bit of a surprise back, more than 10 years ago now, when we first did analyses and looking at bullying and violence in schools around sexual orientation and discrimination on the basis of sexual orientation. And because we ask because people think you're gay, in addition to discriminated because you're gay, we realized that although it's a tiny percentage of heterosexual students who are discriminated against because people think they're gay, lesbian, or bisexual, because they are the majority, that 3% or 5% is actually the same number of young people, or sometimes even slightly more, as the number of gay, lesbian, and bisexual teens who are discriminated against because of their sexual orientation. So homophobia affects everybody. And this is why we think that resources like gender and sexuality alliances or gay straight alliances and SOGI 123 resources and supports actually help create a safer environment for all students. And it does help sort of reduce that bullying that targets straight kids with anti-gay bullying. And that has an impact as well. And I see Heather from ARC Foundation has also put the link in the chat for those who actually want to see all these resources, and they do have them in English and in French. The French immersion schools also are part of taking up SOGI 123. Any other questions? I see Richard's raised his hand.
Were you able to discern anything specific to the experience of trans youth?
So at this point, because we don't have 3 time points where we're able to measure gender diverse youth, trans and non-binary, and questioning young people within the BC Adolescent Health Survey, the first time we actually had these valid measures was in 2018. The SLEFI analysis requires those 3 time points. So we can't specifically say that it works, other than to say that, yeah, the trans and non-binary young people who also identify as queer are part of our sample, or those who identify as heterosexual are also part of the sample, but we aren't able to specifically tease out that particular group. That'll have to wait till 2028. And I see McCreary Center Society is in the room. Shout out for the amazing data and that opportunity. In 3 more years, hopefully we'll be able to do SLEFI analyses looking at the impact of gender and sexuality and alliance and SOGI 1, 2, 3 using the BC Adolescent Health Survey data again. For us, it's a really exciting approach, even though it is complex and requires M+ and some really solid experts on our team, like Dr. Mauricio Coronel Villalobos as our research associate to do this work, because it is complex modeling that allows us to get at causal inference. And when you think about population health interventions or school-based interventions, it would be incredibly expensive and pretty near impossible to randomly assign schools to take up SOGI 1, 2, 3, or randomly assign schools to start a GSA and then follow them. So this approach that is able to allow us to control for those same threats that are what are controlled for when you do a randomized trial allows us to get that causal inference, which is exciting. So I see Simon's asked the question, key facilitators and barriers for implementing this initiative at schools. Well, some of the key ones, as will be no surprise to anyone, are time and money. The ability to support teachers to have the time to explore the resources and to implement them and to take them up, it takes time. Some of the other strategies actually do take resources. If you're talking about creating signage or implementing opportunities that require bringing in like the out in schools or some of the other great programming that might have funding required for it. Some of it might be funding even insofar as creating gender inclusive washrooms. So yes, there are those funds, but a bigger part of it is that teachers are really, really busy, and being able to have that protected time to take up the work. And then the other is really having the leadership, the championship within the school among principals, as well as at the school district level. When you've got leadership who is supportive and thinks this is important and recognizes the evidence base for that this is effective strategies to address key things that they are committed to in school, like ensuring a safe and inclusive school, because if you're not safe in school, you have trouble learning and you have trouble with school achievement. If you don't have that leadership, then it's a lot harder to actually take it up, and it's a lot harder to get the support and the time to do the work. But when that leadership is in place, it does open doors and really does help. Some of the other feedback was they love the materials, and then was like, yes, and now we want 2.0 and 3.0. We want, we've done the sexual orientation and gender identity 101 with everybody, and we've got these great things going on, and now our teachers are hungry for further or leveled additional information and opportunities, or the students are wanting more. So that's always that opportunity. How do you create new materials and then populate them? And what we have seen and the school champions talked about it and the district leads as well. Some of them are creating materials and then they're sharing them with the rest of the SOGI network so that there's additional, sharing the resource cost of creating new materials and new ideas for teachers. I see we have come to 1 o'clock. Thank you all for joining us with this very brief lunch with SARAVYC. Do stay tuned. We will be sending out, we will have another talk third Thursday of June and July and so forth, as we're looking forward to sharing the variety of research that we're doing here in our center and going forward over the next year. So
Wonderful.
Thank you. Thank you everyone for your time and engagement today. And yes, we will be sharing this webinar over on our website and our YouTube channel as well. And yes, keep an eye on our email. We will be sending it in June with the information for the next webinar. Thank you. Thank you, everyone. Take care. Bye.
have a great day.
Yeah.